joining us with the Chamber. My name is Dave Gessel. I'm the Executive Vice President of the Utah Hospital Association. That is the trade groups that works with and represents all the hospitals in the state. And we're grateful for all they've done, and also the nurses and doctors and others in this challenging COVID time. We're also grateful for the Chamber of Commerce. Salt Lake Chamber of Commerce really represents the voice of business through the whole state, and they have been integral in helping move things forward in both on the economic and public health front as we work with COVID. We have a great group of panelists here that have expertise in different areas and that hopefully can give you some tips and ideas that will help you as you deal with COVID. Everyone's had to deal with it, but many businesses have not yet had an employee get COVID, and that's kind of what we're going to talk about today. What happens if you get that call at 8 in the morning saying someone in your office has had COVID, and how you would react as a business. So with that, what we'd like to do is introduce our 4 guest panelists, and then we would give each of them 2 or 3 minutes to talk about some of their thoughts about COVID, and then we'll go into some questions. And also, those of you who are on the call, feel free to send in questions along the chat if we haven't otherwise answered those, and we'll try to get to those. So with that, we'd like to introduce our panel. First, Dr. Donna Milavetz is the Regional Vice President of Steward Healthcare for both their hospitals here in Utah and Arizona. Ryan Shatzer is Assistant Vice President of the Caregiver Experience at Intermountain Healthcare. I think it's Rebecca Fronberg, is a Worksite team lead with the Department of Health, and Jenny Johnson from the Utah Department of Health might also join us. And then Madeline Aller from Durham, Jones, and Pinegar, an attorney that is dealing with this COVID issues that are bleeding over into many legal issues for employers. So with that, why don't we start with Dr. Donna, as I like to call her, and she's a wonderful doctor and been involved in many things here in Utah, and then we'll go to Ryan and Rebecca.
Good morning, or I guess it's afternoon now, to everyone. Thanks for joining us. This is really an unprecedented time in the employer space, that we have an infectious disease that is paralyzing. How do we navigate through that as we move back into sort of the ready and safe for work strategy? I can tell you from a Steward Healthcare perspective, what we are doing, what we're advocating for other employer groups. I am an internal medicine physician and have in terms of preparing for the surge and just managing our employee health in terms of how do we navigate from a mental health and behavioral health standpoint. So I'm looking forward to the conversation with all of you and your questions that you have. Really changing environment right now, and that as the testing changes for our country and for our communities, as new treatment and modalities become available, and as hopefully some additional therapeutics, both in vaccine, we're going to see this evolving strategy for employers. So more to come to that, and my apologies, my internet is a little bit unstable, and so I might intermittently freeze, but looking forward to the conversation.
Thank you, Ryan.
Yeah, I'm in the office today. Usually I typically work from home, but I'm in a secluded office, so I'm going to go ahead and take off my mask. Ryan Shatzer, as you mentioned, a AVP at Intermountain Healthcare. I'm primarily responsible for employee health, as well as our engagement and wellness functions. But it's, we've dealt with COVID on a variety of fronts, but I'll just mainly talk from the perspective of as an employer with employees, and we call our employees caregivers. But it's interesting to note that among our caregivers, we had about 1%. We have a large workforce, but about 1% so far as had COVID. But it's interesting to note that of that group, only 15% we've been able to trace back to acquiring in the workforce. And over half of those instances also, they happen between coworkers, so coworker to coworker exposure rather than those who are actually interacting with patients. So it shows the importance as an employer to mask up and be preventative. Sometimes we've been in this for a few months, so we get a little laxed, and a lot of the exposures that are happening are people that we know versus what we typically might see in a healthcare setting, interacting with people that are actually sick with COVID in the hospital. But that's me, and happy to share some more later.
Thank you. And,
thanks, Dave.
The hospitals and Donna and all the hospitals have been involved in that with a voluntary mask up campaign you might have seen in the media. And this is really important, and we're not going to get into any politics, and there shouldn't be politics on this, because all the studies show that if people will mask up, it helps them not get COVID and also those around them. So anyway, with that, let's go to Rebecca.
Hi, I'm Rebecca Fronberg. In my previous pre-COVID world, I managed a program called Healthy Living at the Utah Department of Health. And I was pulled in as the Worksite team lead for the Utah Department of Health because of my training as a master trainer in a program called Work at Health, where we work with businesses. And so I'm really excited for the opportunity to be able to explain how health department and business can work together to keep employees safe in the workspace, and most importantly, to stay open. That's probably one of the biggest concerns when someone does have a positive employee is, they want to just immediately, I got to shut down and take care of all of this. And no, we want you to stay open. We want you to keep working, but we also want the public and your employees to stay safe. And it's a partnership between business and public health. And we can talk about that more as we move forward with this webinar.
Thank you. Madeline?
Madeline, you're on mute.
There we go. Sorry. Hi, I'm Madeline. I work at Durham, Pinegar. I'm an attorney there. I practice some employment law. And we've seen with COVID-19, we've seen a lot of our clients struggle with how to respond to COVID-19 with, various legal concerns. The obvious concern is how they can protect their employees who may be at risk and how to address employee concerns. But there are also a lot of laws that are implicated by the different practices that employers have adopted in response to COVID-19. For example, the Americans with Disability Act, ADA, it comes into play, and the U.S. Equal Employment Opportunity Commission, the EEOC, has provided various guidelines to keep employers in line with employment laws. There are also some OSHA safety requirements, Fair Labor Standard Act implications, and Family Medical Leave Act implications. And I think today we'll get a chance to touch on quite a few of these issues.
Thank you. Yes, and for many of you, when COVID hit, the first month or two in the healthcare space, the federal government waived a lot of the regulations that we normally have to deal with to help us adjust. That hasn't really happened as much in the rest of the legal world, as Madeline mentioned. And so it's kind of that's an area just like everywhere else. We're all kind of seeing darkly through this, trying to figure it out. And so we appreciate you'll be on here. So we're going to start with some questions that we'll ask the panel. And then in the latter half of this, if you have questions, we're happy to have you let us know through the chat, and we'll try to answer those. But the first one is probably when I thought of it, as one of the leaders in with my team in office of this scenario. You receive a call from a staff member at 8 p.m. at night who lets you know they have tested positive for COVID, but it looks like they'd had it for the prior 3 days and had been around other employees in the last 3 days. So, what happens next? What should you do as far as notifying staff or customers, and how soon? Should the employer call the health department to follow up? When is it okay to return? A lot of questions. So I'm going to start with maybe uh, uh, Ryan on that, and you're with a big entity. What happens? What's happened in your company when someone's tested positive and been around other coworkers?
Yeah, thanks, Dave. I'm not gonna dodge the question, but I'm gonna just stress something really important, and that is preventative, and that's really the first defense. Creating a culture of safety, of wearing masks is critical. So one of our first fundamentals at Intermountain Healthcare is safety, and we talk often about always safe, not just for our patients, but for our caregivers. And I'd recommend at this time that, if safety isn't already one of your values or fundamentals or whatever you call it, I would talk about that, because really leaders set the tone. They should be setting the expectations, but also setting the example. And so that's actually, let me mention one or two other things just around preventative. We have a very robust safety program at Intermountain Healthcare, and one of those principles is 200% accountability, which means I'm not only accountable for myself, but I should speak up for safety for everyone else. It's everyone's responsibility. And a couple tools that we have, I'm just going to share one, is just a principle or a technique we call ARC, and it's fairly popular, but it's ARCC. And so let's say, for example, someone's not wearing a mask or following proper procedure. There's a way to do it that you don't need to shame or create a culture where people are telling on each other, and part of that is the ARC, ARCC. So the first is just ask a question. Do you mind putting on a mask? Next is request a change. Next would be voice a concern, and we have kind of language here where we just say, I have a concern, and then we just express it with one another. And then finally, the last one is to use the chain of command that you have. And so I think we can institute first some preventative things to help with that, and to go further on that topic. Someone gets sick. One, hopefully we can avoid some of these scenarios by doing some sort of screening, or as employees come in, to ask questions if they've been recently tested, if they're showing symptoms, and so you can kind of address the issue as it comes in. But essentially, if an employer has had someone that tested positive, they should notify the people who are identified as coming in and having close contact. And I'll actually let my coworkers here on this call talk about a lot of the facts. They have a lot of detail. But we do our own contact tracing, but you might want the Department of Health to be able to help support that. But that's really important, is to identify those who have come in close contact with those. And maybe, sorry, I'm talking a lot. Maybe I'll let others kind of go down that path, and then I can pitch in. Rebecca, why don't you?
Let me interject there. I like the preventative there. And again, I'm in a small office, and what we've done is we as a company have paid for and bought masks, gloves, hand sanitizer, and many of you have probably done this too, but changed the rules where not as many are in the office at the same time. Those who have private offices, we don't have anybody enter their office. You just call, or you might stand at the door with a mask. But so those preventative things are important if you haven't already done some. And there was a time early on, getting those supplies was pretty difficult. It still maybe can be challenging, but almost any company can get those and institute those. Let's move to Donna now, just maybe what your system has done if you've had someone get it. And then your point is very well taken. I'll move to Rebecca at the Department of Health to answer the question of, how do we notify them, or how do we notify others and contact trace? But Donna, let's just start with the basic. You get a call from someone, what are you going to tell them to do as far as with that staffer?
Yeah, so let's start with the basics in terms of this employee. So number one, we want to know if there's a distance between the employee and their coworker. Okay, so as a general rule, if you use the metrics, and it has to be for at least 15 minutes. That's the standard that we're using in terms of sort of worrying about your coworkers. Again, I'm going to reiterate for everyone that masking is really important and critical to the success of sort of
And Donna, you cut out for a minute. I think you meant if they were in contact with someone 6 feet for 15 minutes or more. Is that correct?
15 minutes or more, exactly. Sorry, I'm having someone to help me with my internet in just a minute. My apologies. Second thing is that if you are that person that has tested us.
I can jump in if you'd like, and we can come back to Donna.
Yeah.
No problem. I know internet problems are always frustrating. So I deal with this on a daily basis on multiple times as I get frantic employees either calling me employers calling me directly or emailing our email that we have that they can contact, and they want to know, what do they do? And as Ryan and Donna have already mentioned about, prevention and then about determining who a close contact is, that's the most important thing. I had a really great call actually just yesterday with an attorney from one of the companies, wondering why public health isn't just taking care of all of this contact tracing. And I told them, well, there's a couple of issues here. We really need a partnership with the business. And the reason is because you're usually the one that finds out first. Sure, we get the labs at the health department, but then we have to have a person go out and interview the positive individual, and then they have to actually tell us that they're employed and tell us who their employer is, and then we have to go and contact the employer. So that takes time. Whereas if you find out that this employee tested positive, you can take steps immediately to go ahead and identify those close contacts, send them home, and then share that information with public health so that we can follow up. We're not out to get all of your employees' information. We're not trying to use that in a way that isn't appropriate. It just goes into an infectious disease database, and we use that to learn and more about the disease and how it spreads. So it's super important to get people to go home, stay home, and hopefully public health will get in contact with them as soon as possible. As you can imagine, we're a little overwhelmed right now.
One of the things I could add in, because I've done a lot with the legislature and the laws and health over the years, is we've had some pretty strict and still have strict laws in reporting on contagious diseases. Now, this one's been kind of overwhelming for all of us, but I think, and Madeline can correct me if I'm wrong, but I'm pretty sure that that there's no legal liability to you as an employer in reporting these kind of infectious diseases to public health, because that's for the benefit of everyone, and the legislature and the others have decided that for us. So, there might be some other legal issues as we deal with how we deal with our patients, our employees, but reporting to public health, I think you're protected legal wise as well. So, and that the partnership is important because, we're all in this together, and if we don't help each other, it just gets worse, honestly. So, okay, thank you. But let me go to Madeline and then back to Ryan. If Madeline, if you had anything you want to add on the legal side, and then back to Ryan.
Yeah, so as far as reporting to like the health department, the Americans with Disability Act does require that medical information is kept confidential, but this does not prevent a supervisor from reporting to the appropriate employer official or to public health authorities, about COVID-19 and about a positive case within their business, so that the public health authorities can take the appropriate actions consistent with their guidance and with the CDC's guidance. So reporting is important, and you are permitted to report this type of information.
Could I just add on one thing too? It's really important not just to report the positive employee, but to report the close contacts, because they have the potential of having the disease. We just don't know yet. So I have had some attorneys from companies try to tell me that they don't have to report the contacts, and I explain again the partnership and how they potentially could have the disease, and so it is helpful to report both.
Great. So let's go to Ryan. And Ryan, we've had a comment of kind of going back to the original question of what happens next if we've got someone that's an employee that calls us and we know we have.
Dave, I'm also back online. Sorry about that. I'm back.
Yeah.
Okay, great.
Donna, I'll let you chime in, but I'll start. So just to answer the question a little more directly, you have those preventative pieces in place, and you've identified those who have been, within 6 feet for 15 minutes, and you're doing the contact tracing. But anytime an employee has symptoms, whether it's COVID or not, if they're sick, just have them stay home. Create that space, give that permission for people to either work from home or be off work if they're not feeling well. That's so important, because if they come in and you have to go through this, it's a lot bigger mess than just having people stay home. So he or she, if someone does have symptoms of COVID, he or she must isolate until they're fever free and the symptoms have gotten better, and it has to be at least 10 days since he or she got sick. At least that's the last I heard from the CDC. It has changed and evolved a little bit. But if the positive employees never had symptoms, but they test positive, they can stop isolation after 10 days after testing positive. Now, if a family member tests positive, the employee should notify you and quarantine for 14 days and monitor their symptoms. And the employee may get tested after the exposure, but they should wait 7 days because it does take some time. Again, Donna, this is more of your field, so jump in afterwards. But unless they've developed symptoms sooner than, if the test is negative at the 7 days, they still need a quarantine for that 14 days. So I guess the take home, if you're not feeling well, stay home. If you get it or you're exposed, to 14 days, but at least 10 days after you're symptom free, if you will, if you test positive.
Great. Donna, do you want to add anything to that?
Yeah. So first of all, absolutely. That's the absolute algorithm for it. And when in doubt, err on the side of always staying home. We have a culture, and this may have come up during my sort of brief absence, sorry, that we have a culture in our country of coming to work sick. Because we're out of sick days or we don't have a sick leave policy, but this is not the time to come to work sick, period. And then if there are questions that you have as an employee or your employees have, you need to create an environment of being able to self-disclose to HR, because lots of other people sort of say, oh, well, my kid's home from college, so this is a scenario for me. And their roommate tested positive. So what do I do? So again, I think it's really important from a culture standpoint is to really give permission to your employees to self-disclose to HR if there is a potential exposure. And then to have HR work with the health department specifically to really question on whether or not that employee should stay home, should they be self-isolating, should they be tested, and when they come back to work. And that is always going to be the algorithm, is err on the side of safety, stay home, make sure that we, determine whether or not this is an asymptomatic exposure, if you're symptomatic or not, and then the time period to re-enter the workforce.
Yes, I think it's important too to kind of follow that chain of command. If you don't need to talk to your workmates or send emails out to everybody that you work with, just go straight to your to the HR or the supervisor with this information. Donna, I have some other questions that have come in I'll get to others as well, but on this one, Donna, someone has asked the question, close contact has been defined as within 6 feet for 15 minutes or longer. Does wearing face masks by both parties allow for reduced distance and or longer exposure?
So that's a great question. We know that when both parties are masked, the risk of transmission is dramatically less. However, if you have an employee that tests positive for COVID, we're not gonna even think about masks. We're going to think about the algorithm, which is you're going to be 6 feet. If you're within 6 feet for 15 minutes, that's the algorithm that we're following, unless there's new guidelines from the health department that I haven't seen. But mask or no mask, it's a COVID positive test, and sort of the proximity is really where we're looking for.
And maybe what's being asked there a little bit too is maybe I'm the person that I was wearing a mask and I talked for 20 minutes with a friend at work who then gets COVID, or I stood within 6 feet for a long time. testing, anyone can get tested if they're worried about it. And right now, I mean, it kind of ebbs and flows, but right now, at least last I heard, we're having less people go and get tested. So my point being is, if you're really concerned that you might have it, many of the hospitals, the public health authorities have drive-up testing facilities, and virtually everyone will be covered for that test through their insurance or through other CARES funds from the federal government. So maybe that's what.
Can I
Go ahead.
jump in and also say that I think it's really important to involve your primary care provider in that conversation if you're worried about it. Because although we do have testing sites and drive-in testing, we really want to make sure that those testing results are under the physician order, and that we're having discussions with our patients, because a negative test may be a timing issue. It may be a false negative test, that if you haven't waited that 7-day period of time, you're going to be falsely reassured. If you get tested on day 2, it's going to be a problem, because if you test negative and you come back to work and 7 days later you become symptomatic, you've exposed people. So I think it's really important to involve the health professionals to really help guide through that process.
Can I add just a little bit to that as well?
Yes,
one of the ways, go ahead.
I was just going to say, excellent point. That's why we have a physician on this panel, and also the public health. Go ahead, Rebecca.
I was just going to say, the way that I explain it to businesses, because they're really frustrated when employees test and they test negative after the 7 days, and then they're like, well, why can't they come back to work? And I always ask people, remember the bell curve that we were graded on in school, and that statistical curve that, we were talking about when we're talking about flattening the curve? The 7 days is right at the center of that curve, and people can be on either end, either testing positive sooner or testing positive much later at the 13 or 14-day range. And so that's why we need to have that entire 14 days.
Thank you. Great points. For you as well, Rebecca, there's a question. Is there a contact number to call if a company has an employee test positive? Who should they call, assuming at public health? Is there a number you can tell everyone?
So they can actually call either the main health department line, which Jenny, I don't have that number right up, but also they can call me directly, my line, or we also have an email that is called COVID response. So COVID, COVID response at utah.gov. And that email gets answered within 2 hours. So they can do that, or they can call their individual local health department. Or Jenny, do you have a main line that people would call with positives?
They can certainly call the COVID hotline, which is answered by our team at Poison Control, and they can provide guidance. Or I'm trying to pull up our health resource line number. I can't remember it off the top of my head. The email is actually that Rebecca just gave is my preference for if businesses have questions, because the people that are answering those emails are trained in Worksites specifically. The quarantine guidelines, the testing criteria that your employees can get tested for is the same across the board, but you have specialists who work with the business owners day in and day out answering those emails in a fairly timely manner. But if you are desperate, go ahead and either use the chat feature on coronavirus.utah.gov, and you can have them connect you to the health resource line staff at the Department of Health, who are also trained to answer those calls or know who to send them to, and can transfer their calls directly to like a local health department if need be.
Thank you. Tell us that email again, COVID response at utah.gov.
I was muted. COVID response at utah.gov.
Thank you. Now let me go to Madeline a little bit with a little different question. And this anyone could answer, but so what happens, what should you tell your workmates that you have been infected, or have we answered that with just go to your supervisor? What do you think?
So I think this kind of is going to go on, every employee is going to handle it differently if they test positive. One thing that an employer can do that's going to help streamline the process is if they do a screening upon the employee arriving at work. So if they are taking temperatures and then asking questions like, have you been in contact with anybody who has been diagnosed positive or who has been experiencing COVID symptoms, and asking them if they've been experiencing symptoms themselves. And then at that point, if they answer yes to those questions, then you have that reported, and then you can follow up with, what employees have you been in contact with, and go from there. Without screening, it's a little bit trickier because then you're just depending on every employee, reporting for themselves, which you're going to have some who do and some who don't. And so the best way is probably just to have a screening upon arrival at the workplace.
Okay. So many companies probably aren't doing that yet. So that's certainly something to look into and consider if you're not doing it. Another question for you, and then maybe Rebecca too, is an employer legally required to call the Department of Health when they have an employee that tests positive?
So a little bit roundabout way to answer that question. Utah has passed a bill that provides immunity to employers. So if a person, an employee comes with COVID, somebody gets COVID from that employee, the legislature recently passed a bill that says there's not going to be liability for the employer. But on the back end of that, they've said there will be liability if there was willful misconduct, reckless infliction of harm, or intentional infliction of harm. So if an employer knows that somebody has COVID and they don't follow up, they don't do contact tracing, they don't report it to the health department, then you might get into some willful misconduct or intentional harm. So I think best practice would be to report it. I think that's your safest avenue, but I'll let Rebecca follow up with that.
Let me go in.
I'll hop in and answer that from what happens. So when you are tested, the test result, whether you're positive or negative, it's reportable by law to the Utah Department of Health and the local health department that has jurisdiction over the county in which the individual who's tested lives. So public health will know if someone is positive or not. All the labs feed into our reporting structure. And so I think that businesses may find some frustration when they reach out to a health department saying, can you confirm that this person was positive, or I have an employee who's tested positive? Because sometimes the health department may not understand what you're actually asking, and they'll tell you, we can't tell you someone's test result. We can't say whether they were tested or not. And legally, the local health departments we can tell you if someone was tested. We cannot tell you their test result. There's been a few instances where unfortunately employees have said that they needed time off due to COVID, but they actually had never been tested. And we know that puts you in a bit of a bind. That's very rare, but we cannot tell you the test result. We can't do that. We try to protect that privacy, but we will know if someone's positive or not. So if you're calling just for like, what do I do? What guidelines do I follow? You may be pointed to the business manual as a starting point, or Rebecca and her team and our local health department teams can sort of guide you through, the people that were exposed. This is what it means to be exposed. This is how long they need a quarantine. That symptom checking becomes really important at that point, and kind of all those other measures that have already been discussed.
Thank you. So I think there was another question that came in that I'm an attorney by background as well. And it's hard to get 100% certainty in any part of the legal field, really. And this is an area that is challenging. A lot is new, but I think there's two simple takeaways. One is, with these communicable diseases, we have pretty strong laws in the state that you do need to report those. And along with that is the corollary that if you're reporting reasonably and appropriately, you won't have legal liability in reporting that. That's part of what these laws have done. Now, it's not 100%. If you're going to do something maliciously or to do something to hurt someone and they really don't have COVID and you report it, well, yeah, then you could be liable potentially. But doing what is being asked by the government under the laws, you should be fine on that. Let's move to another area.
Can I just add one other thing to that?
Sure.
And that is physicians are obligated under our medical licenses to report all communicable diseases that are mandated by the state, and COVID-19 is one of them. So if I'm ordering a test, I am obligated to tell the state health department. So there are multiple different channels by which we notify, but it is an obligation for the physician community.
Great point. Thank you, Donna. So let's move to a little different thing. Oh, was there someone else?
I was just going to add one more thing because I consulted with our our attorney at the health department, because there have been a couple of instances where employers have tried to call to verify whether or not an employee is positive because of a self-report under what appeared to be a little bit questionable circumstances. And I was told that what I could say, while I cannot give the positive result, is that I can clarify whether or not that person qualifies for contact tracing. And so then you can jump to your own conclusions from there.
Good point. Okay, so let's move a little bit off the legal for just a minute and to another question. And we were going to bring this up, but this is a question for Rebecca. Could you kind of walk people through for a few minutes the COVID-19 business manual? It's kind of a step-by-step program that's been put together by the Department of Health, that if you don't have that, you can get that on coronavirus.utah.gov. I think maybe even through the chamber. It's a free manual for anyone that would help you walk through this. The challenge is, I don't know, it's at least 60 pages if I remember. So it's not the easiest to read quickly, but if you just walk through and help businesses understand maybe generally what's in there and the kind of questions it'll answer for them in there.
Sure, and Jenny, you can jump in at any time, because you are just as involved, if more so than me, in the business manual. But what I like to refer to it as is a reference. So you're not expected to sit there and read it all in one sitting, but it's nice because, especially if you pull it up online, it does have a table of contents with links. And so the links are kind of frequently asked questions, and you can jump right to those sections. So maybe one of the most important things we'd like to emphasize with our business manual is that, our goal is to keep you open and to help you continue to work and to keep your employees and the public safe. And then we also want to make sure that you understand what to do when you have an employee that tests positive. So those are the two most frequent questions and concerns that we get with businesses. So there's a lot of different sections in that business manual. We do have it in both English and Spanish. It talks about what are the different steps that you take, for instance, reporting, contact tracing, things like that. We are going to make sure that it has a more extensive section on contact tracing, so you understand, again, that partnership between public health and business and why it's important to share that information. It talks about cleaning. What do you do to clean up if you find out a person has tested positive? And the short answer, you can read more in the business manual, but wait as long as possible, preferably 24 hours before cleaning the area that they were in. If they were not in an area, your standard cleaning that you would be doing anyway applies, but try to ventilate the area, wait as long as possible, and then you can do the cleaning. And there's different guidelines in the manual according to what surfaces you're cleaning and things like that. And there's also a lot of great information about the wage and hour issues, sick leave, staffing and work schedules, how you can kind of stagger those to help people not all be congregated at the same time, how you can work around break rooms and lunch rooms and things like that to keep people from being within that physical distance that we're trying to maintain, that 6 feet apart. And also our Healthy Together app for Utah that can really help with the contact tracing efforts. And the chambers, we are really grateful that they took on our the Stay Safe, Stay Open pledge that we're working on to make sure that you're following all of those phased guidelines. So that's sort of a very brief overview. Again, it is a long document, but it is very user-friendly, and you can click through in the different areas that you need.
So a
yeah, and one thing I'll add to that is that there are scenarios for different Like if you have an employee who tests positive, if an employee's family member tests positive, that will walk you through the basic simple steps of who needs to quarantine or doesn't need to quarantine. So I would encourage you to look at those scenarios, and we updated it for today's meeting to include some information around testing costs as well as the Stay Safe, Stay Open initiative. And so we are happy to make revisions if there's deficiencies in it that you feel your questions are not being answered. That type of feedback is really helpful for us, and we will make those updates.
Thank you. You know, that's a good segue to the fact that we haven't had anything like this for over 100 years. So it's new to all of us, and it's new to the politicians. They don't know for sure what to do. It's new to the healthcare community. We've had to learn what to do. Same with public health. And frankly, you know, sometimes people get frustrated because they said, well, last I heard I had to do this. Now they're telling me to do something different. Well, that's because we're getting more and more studies and tests and things done all over the world that is making it better. Things are a heck of a lot better, at least as far as kind of knowing what we need to know, than it was 3 or 4 or 5 months ago, but we're still in the middle of this. So be kind to folks as you work through this, because and be smart and reasonable and do what you think will protect you and your employees, because there's a lot of simple basic things that will do that. But this report the department's put together is really good. You can get it directly through them, the COVID side, or I think the chamber, if you email them, will give you the link. But I'm going to shift gears a little bit now back to some of the healthcare folks for a minute. We'll start with Ryan. There's a question of a person had as a family member in the healthcare industry, and they shared that they are not taking temperatures when employees show up for their workday, because, as you said, if they are in the mid-range of their 14 days, they won't have a temperature. So what do you kind of recommend in that?
Yeah. What we found was we did temperature checks at all our locations. We recently had stopped that, and the reason being is it didn't really screen folks out. It wasn't effective. In fact, it gave some people a false sense of security that I don't have a temperature, so I'm fine. When really the better questions that can screen people are those screening questions around if they've been tested, if they've had any symptoms, if they've had any close exposure, and so that just helps us better screen folks out. It was a better indicator than doing those temperature checks. Now, I know some other organizations are continuing to do that, and that's fine, as long as that temperature check doesn't give someone a false sense of security that they don't need a mask, or that, you know, if they do have symptoms, that they're still going to go into work. So just be cautious. The principle is allowing people to self-disclose, and if they're having symptoms, to be able to identify that, to keep the rest of the workforce safe.
And as a practical matter, you know, I'm finding with just a small staff, we have a whole, and you're all finding it in your organizations, you have a whole spectrum of how safe people want to feel or what they want to do or not do. And I think if you can, you work through them on that, and just be reasonable. The reasonable man standard. You know, do the smart thing, but be proactive in protecting yourself. Go ahead.
And Dave, and to that point, be flexible. I mean, if someone doesn't really feel, they can do their work at home and they don't feel comfortable. They're at a high risk situation, or they have a family member who's immunocompromised or something. If they can work from home, have them work from home. That would be my advice. Try to be flexible. I mean, we have a workforce, obviously. Our healthcare heroes on the front lines, they need to be into work, but there's a lot of folks who are support functions that we've allowed to work from home to help preserve PPE, to keep ourselves safe, to keep ourselves working, to support the front lines. And so be flexible. If someone needs to quarantine, we've had some nurses who we moved to a call center where they're able to work from home and pick up the phone. So try to keep your workforce working as best you can and be flexible. And there's understandably, sometimes there's work that people just need to be in an office or a warehouse or et cetera. So, it doesn't work in every scenario. And if they do need to go on leave, and this is just my advice, I mean, we're humans here. We're all interacting with each other. Be kind, be polite. Sometimes there's a myth if someone's on leave or away for sick that we can't pick up the phone and say, how are you doing? We care about you. So think about also just the experience, and care for each other. We're all going through this together, and so give each other a little bit of space, a little bit of forgiveness, a little bit of flexibility, a little bit of trust as we work through this together. And that'd just be my advice on the business front.
Hey, Dave, can I jump in also on that?
Yeah, I wanted you to, Donna. Go ahead.
Right. So I'll piggyback on that and say that most of this sort of emotional response is fear-based. And fear does really weird things to people, whether or not it's real or perceived. And so as an employer, I think that, starting from kindness and compassion and cross-training your employees, making sure that you have contingency plans in place for if you have to shut down your workplace again, I think are all really important aspects of keeping your business open. And that there is, whether or not it's real or perceived, there is a bias against people who are COVID positive. And so we need to really make sure that we recognize that stigmata. Some people use it as a banner, right? Like I'm COVID positive versus I'm COVID negative. But I think it's really important from a mental health standpoint to not minimize that, because it is really, it plays with people's heads, and then people start to do crazy things. And that's what we don't want, is for people to start acting irrationally. Is we want people to be very rational, very thoughtful, and very proactive in their approach. So I just want you all to consider that sort of during this time, is that people are just mostly scared. Your employees are mostly scared because they're afraid of dying. They're afraid of exposing their family members, and they're afraid of being the responsible party for that. So just sort of some other things to consider with that.
Thank you. We're coming on our final about 15 minutes. So here's what I'd like to do. There's been a number of legal questions I'm going to put to Madeline first, a couple of those. And then it's maybe in about 5 minutes or so, we'll get to where I'll have each one of you have another minute or two to just say whatever you'd like, things we haven't covered, or what you'd like to say. So, but let's go to Madeline, and I've got a real direct question here. The person says they're an off-premise caterer. Our challenge is non-compliant guests at the event who will potentially be exposing our employees. In other words, maybe they're not wearing masks or they're getting within 6 feet. Do we have liability or any recourse? So if you'd maybe answer that question for them and in a broader sense.
Yeah, so I don't know if being an off-premise caterer, if you have control over the premises at all, but you can test or, do a screening of the people coming into the event if you have that ability. I don't know if, as a caterer, if that's something that you can do. But as far as liability goes, with the bill that Utah passed, no, for the most part, there's not going to be like a liability there if you're at the, premises and a guest comes with it and then it is spread. That's not going to be a liability that is passed on to the company, as long as the company didn't do any sort of willful misconduct. So if the company has an employee that they know is positive, and then they bring that employee to the event and then have that employee, interacting closely with people and not having any protective, gear or anything like that, then there could start to be an issue with liability. But with the bill that Utah's passed, I think that most companies are going to be safe from liability of COVID spreading.
Thank you. In fact, I was involved because I do a lot of lobbying for the hospital association. I was involved in those bills. And so again, nothing's 100%. And really what she's saying is absolutely correct. Unless you're doing something that would, in a normal sense, be wrong, like you're doing something criminally or willfully malicious, something like that, you're likely going to have legal protection for COVID-related things. I mean, again, there's so many scenarios, you can't go run through all of them. But let me go to a second piece on that I thought we talked about, but maybe didn't answer satisfactorily, and that is the reporting to the state. We have another question here that says the business manual, talks about the quarantine for 14 days and all that. And this questioner has a concern about the confidentiality, and if they report that, does that violate their privacy or confidentiality under the laws? Why don't we start with you, Madeline, and if Rebecca or Jenny want to add in, they can.
No, so that does not violate a confidentiality requirement. Employers are allowed to report that to the appropriate health department and health authority. That is not going to be a liability. And additionally, the EEOC has stated that the laws that they enforce are not going to hinder employers from following CDC guidelines or guidance from state and local public health authorities. So if the public health authority is, requesting that you report that, that's not going to be an issue. You're just following, guidance that has been provided.
Thank you. Madeline, I know we didn't get to some other potential legal related questions. If you would just take one more minute or two of areas that you're aware of that maybe we haven't covered, if you feel like you can give some quick advice on that.
Yeah, so just quickly, as far as like screening procedures go, it is good for employers to have a written policy. That way they can show what they've done to protect their employees. They can also show that their policy is non-discriminatory. So when you're implementing a screening procedure, you want to implement it uniformly. You don't want to only screen some employees and not others. That's going to cause problems. So that's kind of a important thing, is just to make sure that you're doing things uniformly. Having a written policy is very helpful. And just generally being looking at the Utah Departments of Health business manual, that's going to help you know what your business should be doing, and following CDC guidance. Those are all good things to keep in mind. And if you're following that guidance, you're going to, be putting yourself in the best position you can.
Thank you. So this has been a great dialogue. I know we bounced around a little bit, partly because we wanted to answer the actual questions coming in, but what I'd like to do is give each one of you a couple minutes to say whatever you'd like that we haven't covered, or if you, the one question we didn't get to is people asking, what are we doing, anything differently now we're in the summer when a lot of our employees are going to family gatherings or family swimming pools or taking trips out of state. But you only need to answer that, I think, if you don't have it within your 2 minutes, if you don't have anything else you want to say. So why don't we start with Rebecca, and then we'll go to Ryan, and then Donna, if we could. Go ahead, Rebecca.
Thank you. I think the most important thing I want to emphasize is that it's in the business manual. This is word for word. COVID spreads very easily and quickly. Even if you and your employees are doing everything right, your business may see cases of COVID-19. And, Dr. Donna talked about how the stigma is around a little bit. And I worked in HIV prevention for 15 years, so I know a little thing about stigma. And people don't do anything to get COVID. It just happens. So I think we just need to see if we can get away from that stigma and show your employees that you care about them and that you care about their health, and they're not just there to do a job for you so that you can make money, but they are a human being and they deserve your care and appreciation. And the way that you can do that is by providing benefits to them so that hopefully they can stay home and not feel like they have to work, so that they can still provide for their families and pay their bills and all the things that we're concerned about. And you do have the ability to get reimbursed if you're a smaller employer with the FFCRA. And just make sure that you're aware of all of the things that you can do to provide for your employees so that they can trust you and that relationship can continue to grow through this whole pandemic.
Thank you.
And I completely agree with Rebecca. Similar to that, just creating a culture of safety. If you have like a really great work environment, you have great career development opportunities and leadership programs, a strong sense of meaning, but you don't take care of the basic needs of your employees, and safety is one of those, they're not going to have a great experience. And it really starts with safety. That's really truly foundational. It's never been so prominent as now with COVID-19. And so I would just reemphasize preventative measures, the focus on safety, and to, as leaders, you have the great opportunity to model it, set expectations, and live it. And that's the strongest thing that you can do to create a culture of safety.
Thank you.
So what I would also add to this that we haven't really discussed is we've talked a lot about, when somebody gets sick, but I think we also have an obligation to share with our employees that if they have chronic diseases, their kids needing to get in for their regularly scheduled immunizations, that the healthcare facilities are safe and ready and open to continue to care for your disease as well as your preventive care that you need. We've seen a huge decline in childhood vaccinations, which is really worrisome from a different public health standpoint. And again, I think it's important that we think about that and we are thoughtful. And then the last thing for me, in addition to sort of what everyone else has very beautifully articulated in terms of the safety and, universal masking and social distancing and really good hand hygiene, is that our kids are going to go back to school in some form, starting next week and in the next couple of weeks. And employers need to buckle in because I think we're going to see some additional cases, and you need to be ready for that because parents are going to be asked to stay at home and pick up their kids from school if they're not going virtual, and just to be thoughtful about that now of what else is going on in our communities, because as an employer, you're going to have to react to that.
Thank you. And, and that's a really important message, when we shut down, if you will, the healthcare system for about 6 weeks, except for COVID, one of the things I don't think we expected, the government and others expected, was in a lot of people's minds, they're now still worried about accessing the healthcare system. They think they'll get COVID or something. And that's the farthest thing from the truth. And what we're actually seeing, and I've got family members that are heart doctors and whatnot, that they're seeing stuff now that if those people had come in a couple months ago, they could have really helped them. And they're delaying so much that they're having some permanent damage. So that is a message to get out to your employers, that employees, that the system is safe. They can go back, they can use it. The odds of getting COVID in the healthcare system, at least hospitals and doctors' offices, are certainly no more than getting it anywhere else, and I think even less. So, because that's the one thing the government hasn't relaxed. We have very strong measures we have to take as far as personal protective and all those rules. So, but that's a positive thing in the broader community too as well. So let's end, if we can, a little bit. If Jenny, if you have something to add, Madeline, and then I'll end with something.
Yeah, just 2 points really quickly. The first being, there's a lot of confusion around the business manual versus the colors, right? And what color rules there are. And the business manual is written to not be dependent on colors. It is a standard. These are the precautions and recommendations that we would have no matter what, if you're in red, orange, yellow, or green. The second point I wanted to make is just to thank all of you. The chamber and all of the employers have been so incredibly good. The majority are good apples and there's just a few bad ones. So I want to thank you personally on behalf of the Department of Health for doing all that you are, for being creative in dealing with this. And we know this is taking a tremendous toll on you. And we all wish that we knew all the answers and all the solutions, but we don't. And so I've actually taken screenshots of all the questions that have come in, and we'll make a commitment that we update the business manual to do a better job of answering some of the questions that you have that weren't there at the time we wrote that. So know that those revisions will be coming, and hopefully it will serve you well moving forward.
Okay, Matt, thank you. Madeline, any final words?
No, I kind of think we've really covered everything. I think all the advice given today has been really helpful and should be helpful for people running their businesses.
Thank you. And I will just end thanking all of the panelists and for the good questions that came in, but also remind us all that, the worst thing that none of us want to have happen is that we have a real outbreak at our offices. And again, we can't control that, but we can do a lot of things to mitigate or not have that happen. The masking, the social distancing, changing policies where we're not having people in the workrooms, whatever. A lot of simple things we can do working from home. Some can't. There's some real important businesses that they're manufacturing things for all of us, food and other things. They're going to have a lot of people there. But those type of companies, you probably ought to be putting extra effort into this, because if you have an outbreak there, it really will kind of shut down again for you, and can impact and ripple through society. So I certainly don't want to end on a negative note, but just try to be safe. And this was meant to have you think through these things and then go back to your offices Monday and update your own policies or talk to your own employees how you can do things better. And I will end on a personal note. Sorry, I'll get emotional whenever I do this. My parents are gone now, but both of my parents grew up in the Great Depression. My dad was actually born in the middle of the 1918 Spanish flu. And they both, mom and dad, were in the World War, serving the whole war. And the point being is, we've done hard things before in this country. We're doing a hard thing now that will be, perhaps defining in our generation in life. But we can get through this if we work together. We're kind, we're helpful to others, and we all work together. And that's kind of been the Utah way. And we appreciate the Chamber putting this together for all of us and all the people that have participated. So have a great Friday afternoon.
Thank you. Thanks, Dave.
Thanks.
Thanks.